is Michael David, and I'm a student of United States University, MSN 572, and I'm here to perform the cardiovascular peripheral examination. And with here with me is Mr. D again to assist me. And before we get started, we need to get verbal consent from Mr. D. So, Mr. D, are you giving me full consent in doing this examination under our recording?
Yes, I give full consent.
And can you please verify that you're 18 years of age?
Yes, I am 18.
Okay, so we shall get started. So before we get started, make sure that you disinfect your hands first by using hand sanitizer. Okay, so before we even perform the actual exam itself, we need to take the blood pressure first of the patient. We need to do a standing one and lying blood pressure, and then we should compare the results. On some cases, the standing blood pressure is lower than the lying blood pressure because of gravity. So we'll assume that I've already taken the blood pressure on Mr. D over here. So now we can proceed to the examination, starting with the neck. So with the neck, we should inspect first, and as you can see, the neck has no abnormalities, no sign of scarring, no sign of lesions, no sign of rashes, no discoloration, and I don't see any kind of masses or swelling that's of note. So the next we should check now is for checking the jugular venous pressure, which is the pressure that is located right behind the sternocleidomastoid, which is you're gonna have to see it. You're gonna have to turn the head over to the left. So if you want, can you please turn your head towards the left, please, and we can look for the palpation of the jugular vein, which is right over here. Which is right in this part over here, and we're going to measure that by measuring it from the distance and height from the sternal angle, which is right here, which is above the sternum. So we can use a ruler and place that on top of the sternal angle, which is right much over there. And with the pulsations, you can get another straight strip of paper or anything straight, and you measure it along where the pulsation starts, which is over here. And the pulsation appears to be around 6 centimeters from the sternal angle. So we're done with that. That was taken on a 30-degree angle. We should now see what we can do with a 45-degree angle. So if you just sit up a bit for me, please. I'm gonna check it for a 45-degree angle. Okay, lie back. Right, for a 45-degree angle, check it again. You've seen the ruler. Turn on your side, please. And it's right over here, on this side over here, pulsation. So one end of the ruler on the sternal notch, and use this to measure the distance between the rulers. And it seemed to be around 5.5 to 6 centimeters, which is almost the same. Okay, so next we shall check on the, can you just look straight, please? Now we can now check for the carotid arteries, which are just right behind the thyroid cartilage. We can check on either side. For now, we shall palpate and see if we can feel any thrills or pulse. But we cannot really press them too long because we need to make sure that there's enough blood reaching the head for that. We don't want to block the flow of blood. So we'll just palpate lightly first on the side of the thyroid cartilage next to the sternocleidomastoid. You can depress it until you feel a pulsation. All right, there's one over there. And same thing for the other side, which is right behind the thyroid cartilage over here and next to the sternocleidomastoid. Press a little deeper. It's faint, but it's there. Okay. Now we shall listen for the carotid pulses. see if there's any thrills. I'm going to use the bell. Could you hold your breath for 10 seconds? Okay. All right. So there's no thrill, but there's pulsation, because a thrill would be a sign of murmurs. That was also a sign of stenosis, so we don't want that as well. So pulsation is fine. So so far the neck part is good. When I was palpating it, I didn't feel any abnormal masses anyway. Um, now we can proceed now to the chest. Now for the chest, same thing, inspect the whole chest, check for symmetry, check for any mass that you might see, check for any abnormalities in the skin part like rashes, lesions, or erythema. Also check for chest wall abnormalities like the sternum part over here, in which case, some cases, some patients have what you call a sunken chest or pectus excavatum, and some of them also have a chest that protrudes forward, which is known as the pigeon breast or pectus carinatum. But his sternum seems to be in a good position. It's nice and flat. It's not caving in. So inspection wise, the chest seems to be okay. Also, we're going to check the apical impulse, which is located on the fifth costal space, and then towards the mid-clavicular line. All I can do is inspect and see if you see any pulsations over there. So we're going to check and see. And actually, I can see it. It's actually over here. There's pulsations over there. So that's actually good. The pulsations are very visible. And next we can actually go and palpate the chest and see if there's anything wrong. So you can palpate the chest around the chest walls lightly and check for any masses or any swelling or any tumors. So far everything's fine. So there's nothing there. Next we shall palpate the pardon me, the point of maximal impulse, which is also on the fifth intercostal space, mid-clavicular line. So it's going to be 1, 2, 3, 4, 5. Mid-clavicular, which is over here. It's quite strong. So okay. So now it's over there. We found the point of maximum impulse. It looks good. And now we should. Was I was palpating the chest. I'm also palpating for any heaves or thrills or lifts. Heaves is like something that actually it's kind of pulsation or an impulse that actually lifts your fingers up while doing light palpations. Thrills is like the normal whooshing sound of or gushing of blood anywhere, and it doesn't seem to have any like that. And next, since we didn't feel anything like that over here, there's no lifts, no heaves or anything, we shall now check for the abdominal aorta, which is the main aortic vein in the middle of the body, and that's located in the epigastric area of the abdomen. And we're going to palpate in the epigastric area towards the center, towards the midline, and you can just press lightly and see if you can feel it. Normally you can't feel it unless the patient is actually really skinny, and it should be less than 3 centimeters, because anything above that could be a sign of aneurysm. And yeah, so we're done with the palpation part. Next we're going to do the auscultation. So we're going to use our stethoscope this time and listen to the chest wall and listen for the heart sounds. So I'm going to first use the diaphragm of my stethoscope and listen to 4 points of the heart, which is the apical, the pulmonic, the tympanic, and the mitral. So the apical part is going to be on the right side, second intercostal space, close to the sternum. Okay. The pulmonic part would be the exact opposite side of where the apical one is. So second intercostal space on the left side this time. Okay, that looks good. Now for the for tricuspid one, not tympanic, tricuspid part, it will be along the fifth intercostal space. 1, 2, 3, 4, 5. Intercostal space. That would be here. Okay. And then for the mitral part, it's also on the fifth intercostal space, but midline to the clavicle. So it's going to be under here. Everything seems to be fine. And then we're going to check it also using the bell of the stethoscope. So it's very clear. Pulmonic. Tricuspid. Then the mitral. Okay, everything seems to be working all fine. And also now we will check out for what we call the Erb's point, which is the area between the second intercostal space and the fifth intercostal space, which would be the third and fourth intercostal spaces. We're going to check it first using the diaphragm. Okay. And now we'll listen using the bell. Okay, it looks good so far. I mean, I didn't hear any splitting, no murmurs, or no other abnormalities in the heart. We can also check for splitting of the S2, which is kind of caused because of the delay of the pulmonic closure of the pulmonic valves, or it can also be caused by the early closure of the mitral valves. And the best way to hear them is have the patient turn slightly towards the left, and we're going to check it in between the second and the third intercostal spaces. So if you just turn slightly over that side, the whole body please. That's it. Not too much. That's it. And we're going to listen. This position actually pushes the apex of the heart closer to the chest wall, so we'll be able to hear it clearly. So the splitting should be in 1, 2, 3, in between these areas, second and third intercostal spaces. So we're going to listen there for any gallops or splitting. Okay, it's nice and loud, but I didn't hear any splitting at all. So that means his heart is actually doing fine. So I can just lie flat in your back, please. Thank you very much. So that's quite good. We didn't find any splitting or anything like that. So next we shall now proceed to the peripheral part. So we're done with the cardiovascular part now. We can now proceed for the peripheral, which means the extremities and everything. Well, extremities and surrounding areas. So first we're going to inspect first all 4 extremities. We'll start with the arms first. If you just put your arms straight down, please. As you can see, the arms are both symmetrical. I don't see any abnormalities in the skin, no lesions, no rashes, no erythema. Um, there's no varicosities or anything. There's no edema. So far, there's no edema on both hands. The color is good, which is pinkish. No signs of cyanosis. Um, and the fingers seems to be in good health, good condition. The colors of the nail beds are also good. Um, Same thing with the legs. The legs appear to be symmetrical in length and size. Um, no signs of any rashes, lesions, or any abnormalities, or any swelling or any other masses. The hair distribution is normal. It's very good. There's no sign of edema. No sign of pitting edema on the lower legs and the feet as well. There's no signs of edema at all. So there's also no varicosities. I mean, there's good vasculature on the legs as well, but the veins seem to be in good condition. No, I don't see any varicosities or any shunting in the area. So next we shall check for all the pulses. So the first pulse we're going to check is going to be the radial pulses, which is located next, close to the wrist of the patient. So we're going to check the right one first. It's going to be just below the thumb area, and just lightly palpate that part. There's good pulse over there, and let's check the other one. That's very good as well. So the radial pulse seems to be fine. The pulsations are good. Grade 2 or +2, because they're expected and they're normal. Anything above grade +2, +3 is actually bounding, which they're not. +1 would be like faint, and 0, of course, is going to be no pulse at all, which is something that don't want to happen. So radial pulse are fine, and now we'll check for the brachial pulse as well. So I'm going to extend the arm a bit and just check in between the crook of the arm, and check for the pulse over there. And there's good pulse there too. There's good pulse there too. Grade +2. And we can also check the arms for any signs of swollen lymph nodes. They appear to be not swollen at all, because swollen lymph nodes can indicate a problem with infection or a problem with the immune system. So the radial pulses and brachial pulses are quite good. We don't have a problem with that. Now we can proceed to the femoral pulses, which are actually in the groin area. So I'm just going to put this thing down a bit. So just going to put it over here. I'm just going to use this one instead. So we're going to first we're going to palpate the femoral areas first. There you go. Okay, so the femoral pulses seems to be good, with a grade of +2, no bounding, it's not faint, and now we can listen to it using the stethoscope. And see how it is, if there's any thrills or bruit. I'm gonna feel used to the diaphragm first, so let's see. Okay, now with a bell. Okay, so I can hear the pulsing of the femoral veins. There's no thrill, so there's no stimulus or anything. It's going to be the same with the other area. Should be the same. Just do them both. Next is we're gonna check that is for the popliteal pulses, which is the pulses behind the knee, and these are kind of more difficult to palpate because it's kind of deep in behind the knee. So what we do is we're gonna flex the leg a bit, and with both hands try to press behind the knee to locate the pulses. It's gonna take a while. Just relax your knee, relax your leg. That's it. Okay, I felt that one. All right, so I felt that one. Uh, it is hard, um, but when you feel it, it actually feels like it's faint, but it's not actually a +1. It's more of a +2 because the pulsation appears to be firm and regular. So we'll do the same thing with the other knee. It's taking a while. Okay, got it. It's also a bit faint like usual, but it's steady and it's firm. So I would rate it as a +2 still, because I don't see any problems with the leg with the leg perfusion or leg flow well flow of the blood or anything. Um, so yeah, now we can proceed to the next part, which is going to be the posterior tibial ones, which is actually behind the ankle of each ankle, which is going to be the inside part of the ankle. So the first one would be right here. That's the posterior tibial. There you go. This is easier compared to the popliteal ones. And it's also the same, steady, firm, and with a +2, as expected. And for the other side, I'm going to press it over here as well. There we go. Same thing. It's not bounding. It's firm. It's steady pulse and a +2 grade. Okay. And the final pulse we're going to check is going to be the dorsalis pedis one, which is actually in the anterior part of each foot. So for the left foot, we're going to check just above it. There we go. So it's the same thing. It's not bounding. It's not weak. It's actually very good pulsation. I would create a +2 as well. And also over this side, we're going to press the dorsal part of the foot. Same thing. Not bounding, not weak. Normal as expected. Firm and steady. Okay. So now we'll check for that. And now we're going to check for, oh, before that, I forgot to inspect the abdominal aorta using my stethoscope. So I'm going to listen to that before I proceed to the next one. So a while ago I palpated the abdominal aorta and I didn't feel anything. So now I'm going to listen to it and listen for any thrills or anything unusual. So just going to listen. I'm going to use the bell of my diaphragm first. And we'll just listen. Okay. There's the bell now. Okay. Now, usually with the abdominal aorta, we don't really hear much or don't hear anything except in cases where the abdominal aorta is actually has an aneurysm on it or it's enlarged, in which it makes it closer to the abdominal wall where we can actually feel or hear it when it's that large. So it has to do with size. So when it's normal, if it's less than 3 centimeters, it's kind of way deep down in there, so it's kind of hard. But I assure it's quite normal. So now we're done with the aorta. The last we'll have to do is check for the digits, the fingers and the toes, and check for capillary refill. Um, Capillary refill should be less than 3 seconds. So we're going to check the fingers first of the right hand. All you have to do is just pinch the fingernail and check the refill. That's good. That's about 1 second. That's 1 second too. Yep, that's good. Check for the other one, please. Thank you. Okay. All right. Okay. So the capillary refill on both hands appeared to be normal. The refill was below 3 seconds, which is 1 second each, and we're just gonna go and do the toes as well. So let's start with this one. Check each toe. Okay. All right. Okay, the other foot. Right, the capillary refill on the foot is slightly longer compared to the fingers, but it's still less than 3 seconds. His fingers had 1 second for refill, and the toes actually took about 2 seconds, but it's still within the accepted range for refill. Um, Now we're done for that. We're now going to check the fingers for clubbing, which we did also check a while ago about the fingers. We checked them already to see if there's any problems with cyanosis or splitter hemorrhages, which doesn't seem to be have anything in there. No clubbing at all, because the sign of clubbing, if there's clubbing in the digits, it would mean there's a problem with it's going to be a problem with the cardiovascular part, not perfusing well on the digits of the finger of the hand. So fortunately, my patient over here has a very good cardiovascular system, so the blood is being distributed very well in the peripheral parts of the body. So there's no abnormalities at all. And that being said, we are actually done with our examination. So thank you very much for listening, and I'll see you again next time.